Dr. Mallika Goyal.
So I'm not a PG student unlike everybody else here. So I chose not to be sitting on the dais because I'm a presenter. It's actually, I did not mean to compete with the PG students, but my idea was to highlight what we have been seeing post vaccination. So because it's a 6-minute talk, I'm showing very few cases. PowerPoint has converted this, changed the alignment from Mac. Uh, we could classify them broadly as vascular occlusions, inflammations, CNVM, either new or reactivation of previously stabilized CNVM RP detachments, and neurophthalmic manifestations. Most striking was vascular occlusions. In young people with no comorbidities, this was a retina specialist, 38-year-old, 3 days post Covishield second dose, came with CRVO and IT inferotemporal BRAO. We treated her with oral steroids, anticoagulants, and aspirin because we believed it was inflammatory, with significant improvement in symptoms and all her symptoms. She was not keen on getting the antibodies done. The next the next patient was a young man, 28-year-old, 11 days post second dose of Sputnik, no comorbidities, developed HRVO with macular edema. COVID antibodies was almost 3,000, where we need only 50 for positive. Physician consultation, and again he was treated with steroids and anticoagulants, but the macular edema did not resolve unless ranibizumab was given, and he improved to 6 by 6. Another very striking young man, no comorbidities, 7 days post second dose of Covishield, came with ophthalmic artery occlusion, nothing found. And his COVID antibodies was moderately raised. I'm sorry, it's not mentioned here. He was investigated. It was raised, but not to the level of 3,000. Then we had a second group with lots of uveitis coming in, all types of uveitis immediately following the vaccination, within 2 weeks of vaccination. So this was our first patient of post-vaccine multifocal choroiditis was our first inflammation. Sudden loss of vision 4 days following the vaccine. He's an ENT surgeon. And again, no comorbidities, never had an autoimmune problem. Bilateral multifocal choroiditis, which resolved on steroids but required steroids for 8 months and immunosuppression for 2 years with azathioprine. Now he's okay. This was a young girl who had immediately following her Covaxin developed vitritis, treated elsewhere with steroids. When she came to me in January, she had already been on steroids for 6 months. I saw this picture, retinitis, so I stopped the steroids. So what happened is a month later, and I investigated for other causes, which were all negative. But when I stopped steroids, she comes back with severe retinal vasculitis, again started steroids. 2 months later, we stopped the steroids and she resolved. But a year later, off steroid but on azathioprine, she has come with tubular fields just few days back. And now we are again investigating her, but started steroids again. Point is, these patients need steroids for a very long time, unusually compared to other patients that we treat. We don't know what's the cause for tubular fields. We have got an MRI done, but MRI is not going to explain tubular fields. Now, the important thing in this patient was she had an iritis following COVID infection, and then she had this vitritis following vaccination. So manifestations that happen after the infection can also be reactivated following a vaccine because they follow a common pathogenetic pathway between the virus and the vaccine related immunomodulation. Now this is a young lady, 32-year-old lady with sudden vision drop noted on December 12. She got her first dose of Covishield on December 3. And she was treated by Dr. Gopal Pillai actually. The pictures are from him. I treated her subsequently. Presentation, this was the picture. And after that, 3 doses of aflibercept given by him, she has been stable. You see there is a CNVM as well. He had not done the COVID antibodies, so we don't know about it. By the time she came to me, it was probably late. Now we have lot of patients, lot of AMD patients that I have been treating for years who were stable, not requiring treatment. But after their vaccine, they came with sudden symptoms within days, and they would now, you see this patient, I was just observing without treatment, if you see the upper part of the slide. But then he came with symptoms and I had to start treatment, and now I have to be very aggressive. For the last 2 years almost, I'm giving him injection every 2 months, which I never had to. because the disease is so aggressive, most of these patients, their course changes permanently. At least for 2-3 years, I am finding that I have to give very aggressive treatment to bring them down to some kind of stability. And in many of them, the fellow eye has got affected, which was not affected within 6 months of this. I don't know whether it's related, but many of these patients, I removed them because of the paucity of time. And then we had optic neuritis following vaccination. But very interestingly, we found cases of idiopathic intracranial hypertension, which never happens in a middle-aged man. I have not seen till now. I have seen in women, young women, or even young males maybe, but not middle-aged. But I saw it post-COVID infection. I have patients who came with severely raised intracranial pressure, normal MRI, and they were middle-aged men. And now I saw post-vaccine. So this post-infection, post-vaccine, there is an overlap in the manifestations, and you are seeing raised ICT in middle-aged men, which is very rare. Resolving with steroids and diamox, but not very easily. It takes a longer time than others. Similarly, a young lady developing immediately after vaccination. Thank you.
Ask something. Yeah, sure. You've done really a lot of work on COVID. Your first article was also published in AIOC. Yeah. It's very nice that you've really stated right that both the virus infection as well as immunization, they're in the same pathway.
Absolutely, we are seeing the same things.
Yeah.
First we saw in COVID infection time, and when the vaccine came, we again got a spurt of the same sort of cases.
Yes. So do you recommend, like there is no financial interest, but which one is better, Covishield or Covaxin?
No, we had the variety all over across, even Sputnik. So I would say they are all equally bad. I had most of the cases I had was AMD, which was getting worse. And there Covaxin, Covishield was equally distributed.
Yes, that's true. Even literature also does not differentiate between them. Yeah.
Thank you.